phones on mute, that would be great, and so we don't get interference. And the other request is please don't put us on hold, because if you put us on hold, we usually end up with some music that is pretty distracting. So thank you. So one of the things that we wanted to let people know is the framework that we have for developing a trauma-informed system of care in Missouri. We have a developmental model that was developed. If you're at your screen, the question was, why did we develop a model at all? And one of the things that we started to realize in the state is that trauma-informed care is a new buzzword, and we have a lot of folks saying that they are trauma-informed when they may be providing trauma-sensitive services or trauma-specific services, but they're not necessarily, haven't gone through a process to actually become trauma-informed. We also were very, very aware that trauma-informed words are being used in a variety of ways, and we wanted to really bring some ardor around trauma-informed and trauma-sensitive practices. So not trauma-specific services, want to make a little bit of change in definition. So when I'm, just so that people know, when I'm talking about trauma-informed care and practices, what we're really talking about are how do you receive your clients? What are your processes that you have in place? What are your processes that you have in place for your staff that are trauma-informed in the ways of supervision? What is trauma-informed in the way of onboarding and orienting staff? How do you approach vicarious trauma or secondary traumas from a personnel perspective? Trauma-specific services are those services that are evidence-based or best practices, like parent-child interactive therapy, EMDR, cognitive processing. So just know that when, as I move forward and talk about trauma-informed care, we're talking about your basic operational processes that any of your staff might be using. So just to take a little step back, the Department of Mental Health several years ago created an early adopters group, and in that early adopters group there was a fair amount of work around what are sensitive practices, are universal practices, what are things that that we could take forward and implement across a variety of systems. So the Department of Mental Health helped us develop a shared definition and understanding. They also brought in a consultant to help us take the mystery out of the process and to really help move this forward. And then the other piece that we really wanted to work on is how do you move from being trauma aware to actually being trauma informed. The leadership group then that that participated in the development of the model is actually a number of organizations from all around the state. We had people from the Children's Division, from Division of Youth Services, we had community mental health centers, we had substance use providers, and those folks really represent clients that we serve across the lifespan, and we also really try to include a lot of people who have a lot of different areas of expertise. So people who are actually providing trauma-sensitive practices, trauma-specific services, and people who have actually done some real work around vicarious trauma. So the Missouri model itself now can be used by organizations, and again, the design was for a variety of organizations. It could be used for businesses, it could be used for clubs and social clubs and boys and girls clubs, Girl Scouts, things like that. And it is a roadmap to move from being trauma aware to becoming trauma informed. It's also a public document. You can find it at the DMH website in the Trauma Informed section. It also can provide for you some guidance not only for your own organization but for other organizations in terms of where they are on the continuum. So the model itself anchored in the 5 principles of trauma-informed care: choice, collaboration, empowerment, safety, and trustworthiness. And so the whole model, as we go through the model, you'll see this, was built around attention to those 5 principles. So the goal here is to move and to recognize that becoming trauma-informed is an ongoing organizational change process. We also have really worked hard for people to know that it's an approach, and it will lead to cultural shift. It is not a flavor of the month. It's not something that you can do and then be done with it. It requires shifts in knowledge, in skills, in perspective. And one of the things that we found through the roundtable is that staying trauma sensitive, staying trauma responsive, staying trauma informed requires ongoing attention from leadership. So the model itself was designed to make sure that we do no harm, that we really continue to assess the implementation of the basic principles of trauma-informed approaches, that we develop common language, and that we really, really do increase the effectiveness of overall services wherever and whatever they are, and looking for improved outcomes as a result of being trauma-informed. So one of the things, again, that as we developed the model, we really, really worked hard to make sure that it's not a certification process. Many of us were very, very challenged and challenging to the Department of Mental Health to say, we're not ready for just one more certification. We already have so many people coming through, certifying us, authorizing what we do. We want to move through the model. We want to move through the continuum. We do not want yet to be certified. Now, over time, that may change, but that's where we are today. So the real goal of the model is to help people who are interested determine where their agency is. It is a tool to help people with action planning, and then to move forward so that they actually are involved and engaged and can engage their employees in a process. So the 4 steps, and before I go into each of them individually, let me just say the 4 steps are trauma aware, trauma sensitive, trauma responsive, and then trauma informed. So at the trauma awareness level, we want to be sure that we have organizations that are aware and that understand a little bit about what trauma is, begin to understand the impact of the brain science, that we want to begin to train staff on trauma awareness. We want to make sure that people start thinking about and talking about trauma at an informal level. Trauma-sensitive level is really beginning to have knowledge, application, and real skill development. We want to work around, as organizations, what do these principles mean in our organization? So there's a very individualized approach. What does that mean? In some cases, just one of the assessment domains is environment. So as you walk through your environment, are the colors inviting? is your signage inviting? Do you have a lot of locked doors that would give messages to your clients that they're not in a safe environment? So those are the kinds of questions you begin to ask as you become trauma sensitive. The other step that starts to happen at the trauma sensitive level is you have champions, and those, you begin to identify people who really resonate to this information and who really decide that this is something that they want to take time to develop in their organization and then to contribute throughout the organization. So you begin the process of developing a mission statement, you start doing some training, and you start recognizing where you do have vicarious trauma. So the trauma responsive stage is really about change and integration, and you begin really then to look at all levels of the organization, and you start looking at how are we hiring people, how are we onboarding people, how are we doing our intake with our clients, how are we responding to our clients, what are our rules and regulations, and you begin to develop action plans related to those, to your findings from your assessment. So the piece on trauma responsive really also then includes, okay, let's take a look at our screening tools. Let's take a look at, do we have a trauma assessment? Are we gathering the data? Are we using that data? You will start changing the environment, start paying more attention to your staff, and then really looking at how do we respond to a crisis. We have organizations that we've worked with in the past, for example, who have at past times had a client who has had a violent incident, and the employees who have been involved in that incident are still expected to work. There's been no debriefing, or there's been no time, and then as they become trauma both aware, sensitive, and then responsive, they start recognizing what they need, what steps they need to put in place in order to be more kind, more compassionate, more trauma responsive for their staff. So trauma informed is the final step in the model that we put together. We have, and really one of the things that we've noted all along is that leadership is key to this entire process. But at the trauma-informed level, we are looking for leaders to actually lead the way on policy and procedures, to work with their boards, to work with their key stakeholders around trauma, around resilience, and making sure that it's every aspect of the business incorporate some understanding about trauma. So, Katie, I might need a little bit of help here. In terms of the application process, for the Learning Collaborative, we ask that each organization identify team members, and those team members should include various representatives from all over your organization. Certainly there should be somebody who sits at the executive table who will be at the Learning Collaborative and who will commit to the 2-day session, as well as then commit to participating on the webinars. Then the other question that we're going to ask is in the application process is, where are you now? So are you at the trauma aware? Are you pre-trauma aware? Are you already well on your way and you feel like you're at the trauma responsive level or the trauma informed level? The consultation process is very, very exciting. I think that every time I participate, I learn something new, so it's a very exciting and informative process. It's a 2-day pre-conference training, and one of the things that you'll accomplish during that time is sitting down and really talking about who should be on your each respective trauma committees. You'll start your self-assessment process, begin the development of a plan. You will have ongoing consultation with Raul Almazar, a national consultant who has a wealth of information. Every time I meet with Raul, I come away with pages of things that I should think about in my own organization. You will also have available to you folks from the Department of Mental Health, and the beauty of a learning collaborative is that you have an opportunity to learn from your peers. So I don't know if we're off mute. Would really like to hear people's questions, people's comments. I went through that information a lot, pretty fast. Hello?
Have a majority of the people off mute. So if anybody has any questions or would like to talk.
Kind of would like to know where people. Oh, right. There we go. Where people think they are. Why are people interested in this learning collaborative? Questions about the model?
I'll talk. Can you hear me?
I sure can.
Well, this is Joyce Estes from Northwest Missouri Children's Advocacy Center. In fact, I had 2 of my therapists go through a webinar earlier about this, and we're very interested, brought it to our staff meeting. We're definitely going to get this turned in and apply. I think we are probably at least trauma responsive, in a lot of ways trauma informed, but I think it would be good to get the whole group together, and there's always more we can learn, and see what else we need to do.
Well, it sounds like you'll have a lot to contribute.
Well, maybe. I've been doing this for 23 years, so a while, but.
Well, then we'll look to you to help contribute lots of insight and lots of expertise.
All right. And a lot of learning yet, too, though.
Well, you know, I'm pretty old, and I just learn something new every day.
That's right.
The science just keeps advancing, and so the more that the more that the MRIs, the imaging, all of that really seems to be moving us in a direction where we can really, really, truly begin to understand the brain and what the behaviors then, even my own behavior, I understand better now that I understand the brain. So there'll be some of that that I think people will find very exciting. Thank you for being the first one to talk, by the way.
Okay.
This is Leslie Wiss at Great Circle. Can I chime in?
Please.
So I thought I'd chime in and share that we're involved in trauma-informed care as well. And so we have participated in the learning community with the National Council for Behavioral Health about a year ago. And I would say that from our perspective, we've made some great strides all 4 areas of all 4 steps of being trauma-informed, but we recognize that we have not completely mastered any areas. It's interesting that, you know, we've kind of hit a couple points in each category, but we by no means, we believe that we know and recognize that we're not trauma-informed, and we're on a journey to get there. We're interested in joining this learning community at the Missouri level, just as we continue to be diligent and strategic about our processes. We want to continue to learn and continue to embrace the Missouri model. And then the other piece that I wanted to add is that we have this last year launched the site certification process for the neurosequential model of therapeutics and the neurosequential model of education. And I can't agree with you more about how the brain science fits in and how important it is for us to understand how the brain is impacted by trauma and how it responds as a result to stress.
Exactly, and I know one of the exciting things that's going on at one of our agencies here in Kansas City is as they're working with the kids, they're helping them look at their feelings and the situation with the feelings, which I know that a lot of us do anyway, but then what they're adding on to it is, here's what's happening in your brain now, which is why you're responding the way you do, which I think is just really, really cool, because then what's happening for the kids is they're starting to realize that they're not bad people and they're not out of control and they're not, you know, and they start understanding sort of their own body and their own brain in a different way, and they're starting to learn how to regulate their emotions more effectively. And that's because now we really are beginning to understand the brain at a much deeper level than we ever did before. Isn't that fascinating?
Yes, it is.
Very exciting.
So glad, I'm just seeing great circle people all over the place. The other thing, just while you're thinking, the other thing just to say is, through the roundtable, we've learned that there are a number of organizations who have been on this journey in this culture shift, transformation for many, many years, and several of them have reported, you know, we're not there. We have to continuously work on this, because as we hire in new people or we have experiences in our communities, it's easy to go back to old ways of thinking. And so, you know, this is a real ongoing process. And so it's sort of like with cultural humility and responsiveness. There's no there. It's just we're going to continuously be better, and we're going to continuously learn, and we're going to continuously implement even better practices than what we have today. So, other thoughts, other comments? I know it's a Friday afternoon, but...
Does anybody have any questions about the application process? Right.
We do, Katie and I were talking earlier, we do want to have at least 6 organizations involved in the Learning Collaborative. So for those of you who have connections with other members of this group, if you'll let people know that they really, you know, need to think about applying, and it's going to be great fun, and we'll have all kinds of tools available for people.
Well, how many people do you have on this webinar?
We have 7 people attending the webinar. I've actually gotten 2 applications already, and we can have up to 15 agencies, but I'm hoping that we get at least 6 applications. If we get up to that 15 application mark, that would be great.
Okay.
So just spread the word. We are recording this webinar as well, and we're going to post it up on the Missouri Children's Trauma Network website, which is www.moctn.com. There's this PowerPoint and the webinar recording and any other information regarding Learning Collaborative will be posted online there. So we welcome you to send anybody who you think would be interested this information. Okay. And the applications are due on February 12th, And I'll be sending out notice of acceptance on March 7th.
Now, the application says it's due the 15th,
Oh, it says the 15th. Okay, 15th is fine too.
which is also a holiday.
Yeah.
But that's all right.
So if it comes in on the 16th, would you accept it, Katie?
Yes, I would accept it. We have plenty of time in between there
Okay.
Yep.
to review the application.
And the 2-day training is March 21st and 22nd?
Right, in Jefferson City.
So people will need to think about their teams and do a really careful, thoughtful process of sending some folks. What has been interesting as we've created teams throughout our organization, I always try to get somebody who doesn't think that trauma-informed, well, let me say, I have some folks here who will say, well, trauma-informed practices are just ways to excuse bad behavior. And so I always like them to be, at least one of them, to come, to learn, and to see if we can't get the light bulbs to go on for them.
Right.
Mm-hmm.
Because if you can get one of your folks who isn't so sure to become one of your champions, then there'll be a lot of other people who go, wow, this must be really important stuff.
This is Leslie again at Great Circle, and we have put some thought process around our team, and so I have just a quick question. One of the members of our team we've identified a position that we would like to be a member. However, that position has not been filled yet. Is that okay if we go ahead and just kind of put that flat on our team application, and then if something needs to change, that we submit and fill with a different person?
This is Katie, and I don't see any issue with that.
Okay, thank you.
I have a question about the dates of the workshops and the training. You say there's a 2-day pre-conference training on the 21st and 22nd,
Yes.
and that's for everybody?
That will be for everybody who's accepted into the Learning Collaborative, yes.
Okay, and then on, say, like, if I'm coming as a senior leader administrator, then I also have to be there on the 23rd, and then the 24th, and the 25th, or whatever. So the whole week, basically.
No.
No.
I'm not sure what.
Well,
date
it
you're
says
looking at.
attend senior leader trainings, March 23rd. Okay, so that would be...
Are you looking at the TSCBT by chance?
Nope,
That's
I'm
different.
looking at this thing from MOAX.
Yeah,
Is that
that's the
the same thing?
TSCBT training. No,
That's not
different.
what you're talking about?
No, we're talking about the Trauma-Informed Learning Collaborative. That's TSCBT.
Oh, my goodness, my goodness. Okay.
Yep.
So I
Sounds
have
like you.
trauma-focused CBT learning collaborative packet here, and then you
Yeah.
have a different packet that you have to have the whole team with too.
Yes. It's a different learning collaborative. That's just it's more about the TSCBT is a specified training,
Right.
and the Trauma-Informed Learning Collaborative is more agency focused, as well as people within the agencies that work there. It's kind of changing the whole entire agency's perspective on trauma-informed, which is very different from TSCBT.
But you're both having them right at the same time, practically.
Yes.
Maybe.
It actually should be maybe different people if you think about it.
Well, we have a very small staff, like 5 people.
Okay. Oh, well then, yes.
So I don't think it would be different people.
Right.
Unless I sent my board of directors or something. Okay.
That'd be cool.
So is the application packet going to be on the website or where?
Yeah, the application, actually both the TFCBT information and the Trauma Informed Learning Collaborative information is on that website that I had mentioned, the www.moctn.com. All the information for both of those learning collaboratives are up there, so whichever one you choose, whichever one makes most sense for your agency.
All right, thank you.
Anybody else have any questions for Katie or I?
I think we will call that good then.
All right.
We appreciate everyone's time, and thank you, Marcia, for doing the presentation. If you guys have any questions, please feel free to email me. My contact information is on the website. I'm Katie Horstman. I'm sure you've seen emails from me other ways, but if anything comes up, please let me know. Otherwise, have a good weekend.
Thank you,
Thank
Kate.
you.
Thank you.
So now we can